Hello everyone, I would like to welcome you to another histology presentation. This time the topic is the female reproductive system. We will talk about these structures. You already know them from anatomy. So we can divide them to the internal female reproductive organs, which are paired ovaries, paired uterine tubes, uterus and vagina. And then the external genitalia, which include the labia majora and minora, and clitoris, and also the vestibule, like the opening of the vagina and the external urethral orifice. You already know the physiological position of internal reproductive organs from anatomy, so I will not repeat that. And you already know the purpose of those organs. So let's start with ovaries, which are like almond-shaped paired glands, which the major function of these glands is the production of gametes and also the production of steroid hormones. So during the production of gametes, which are called the oocytes, the ova are released. So the ova are the major gametes, and they are released into the peritoneal cavity, where they are infused to the uterine tube. And the purpose of the uterine tube, like the muscular tube, is to transport ovum towards the uterine cavity, and when there is a suitable environment, to ensure physiological site of fertilization, which is usually in the ampulla of the uterine tube. Then, of course, the uterus, which supposed to ensure proper environment for developing embryo and fetus, and of course to ensure the delivery of the baby, together with the vagina, of course. So, what about the histology of the ovaries? So, at the surface of ovaries, we can find the one-layered epithelium, which used to be called the germinal epithelium, but it is a misnomer. We should not use this name because it used to be thought that the gametes, the germ cells, are they're products of this epithelium, but it's not true. They are not source of the ova. So we should not use the term germinal epithelium, and we should call this epithelium the ovarian surface epithelium. So the surface is covered by this epithelium, which is like single layer of cuboidal, in some parts almost squamous cells, which are modified mesothelial cells. And under this epithelium, there is a dense connective tissue layer called the tunica albuginea. Tunica albuginea is like fibrous, dense connective tissue, which is like the source of the whitish color of the ovary. Ovary itself can be divided into superficial cortex and underlying medulla. So they are not so distinct regions. The medulla, which is like inside, it contains a loose connective tissue, a lot of blood vessels and lymph vessels, and also nerves, but it doesn't contain any follicles with oocytes. Follicles with oocytes can be found only within the cortex of the ovary, which is like superficially. So it is located between the tunica albuginea and the medulla. These two regions are not usually distinctly divided. And so let's start with the cortex, like the outer part. It's this part. The hilum. Hilum is the place, site where the blood vessels enter and of course exit the ovary. It's just a hilum. So superficially there is ovarian superficial epithelium, then tunica albuginea, then is a cortex containing follicles with oocytes, and in the center part there is a medulla with blood vessel network and nerves and lymph nodes. Let's start with the cortex. So the cortex contains ovarian follicles in the different stages of maturation. Each follicle should, or not each one of them, but follicles generally should include oocyte within. We can see various size and different stages of maturation of these follicles, and between the follicles there is a connective tissue stroma. This stroma is made by special fibroblasts and then collagen and reticular fibers, and we can also find the smooth muscle cells within the stroma. So what is this? This is the superficial epithelium. You can see that. Under the epithelium there is a dense connective tissue layer called the tunica albuginea, and then there is cortex of the ovary, with follicles containing oocytes and connective tissue stroma between the follicles. Medulla, on the other side, is made by much looser connective tissue, so there's loose connective tissue containing the blood vessels, lymphatic vessels, and nerves. And also near to the hilum, there is one type of cells you can find called the ovarian Hylo cells. These cells are very similar to Leydig cells in testes. They are slightly eosinophilic, containing ring-case crystalloids, and they create some kind of accumulations or nests, and they produce some amount of androgens. So the most important information is that you cannot find any ovarian follicles in the medulla. This is how medulla looks like. You can see blood vessels and loose connective tissue with fibroblasts. And let's talk about ovarian follicles now. So the oogenesis occurs during the fetal life. There are cells which are derived from primordial germ cells, which are called the oogonia. Then, during the fetal life, the mitotic divisions massively increase the number of these oogonia, and then they become to divide. to all sides. We will talk about that later, but the like there are various types of follicles we can find within the ovarian cortex. Each of these contain one oocyte, which is surrounded by one or many layers of cells, which are called the follicular, later are called the granular cells. These are the stages of development of the ovarian follicles. So first are the primordial follicles, then the primary unilaminar, which is one layer of cells, multilaminar primary follicles, then secondary follicles, and the Graphene follicle, or sometimes called the tertiary. This is the image of the ovulation. This is the bulging of the Graphene follicle to this superficial part or external surface of the ovary. This bulging is called the stigma, folliculare stigma, and this is the released ovum with the adjacent cells. So let's start with the first stage of development of follicles, which are the primordial follicle. They are present during the fetal life, and they are present in the cortex of ovary until the puberty, and then during each of the ovarian cycle, some of those follicles start to develop, and only one of them will completely develop. It will complete the development and release the ovum during ovulation. So the primordial stage of development of follicle can be present from the fetal life until the menopause, which is like the ceasing of the ovarian cycles. So primordial follicles contain one oocyte within, like there, with one layer of squamous epithelial cells around. These cells are called follicular cells, and they have their basal lamina, which is here, the pink one. So that's basal lamina, sometimes called the Slaviansky membrane. So this is primordial follicle. Usually we can find these follicles near to the tunica albuginea, that means near to the surface of the ovary, like that. So these are the primordial follicles with the oocyte within. The oocytes have rounded nuclei, usually concentrical. So you can see this is the nuclei of the oocyte, and you can see one layer of flattened squamous follicular cells. This is primordial follicle. Again, the oocyte with the nuclei and one layer of follicular cells. These are the nuclei of follicular cells. That's the same. So that was the primordial. Then, when the group of follicles starts to develop, we can find their primary follicle. Primary follicles, we have two types of primary follicles. First are unilaminar, which are made by one oocyte surrounded by one layer, this time by cuboidal or sometimes higher epithelium, but that's still one layer, right? These cells are still follicular cells, but they start to appear like their cytoplasm start to appear like granular. So they are called the granulosa cells. That's the same as follicular cells. It's just a different name, but those cells are still the same. So unilaminar primary follicle is made by one layer of this time granulosa cells surrounding the oocyte, and between the granulosa cells and the oocyte, another layer starts to appear. This layer is called the Zona Pellucida, and it is a very important layer made by extracellular proteoglycans and proteins, and this is necessary for proper penetration of sperm within the oocyte and fertilization. On the other hand, the multilaminar primary follicle is made by one oocyte again. Now that there is a proper zona pellucida, like there, and many layers. Usually there are 3 to 5 layers of granulosa cells. Granulosa cells are still cuboidal, and they increase their number. That means that they are not in one layer, arranged in one layer, but they are arranged in many layers surrounding the oocyte. So that's the reason why this follicle is multilaminar and this is unilaminar. Again, granulosa cells, they have Slaviansky membrane. It's a basal membrane, and the surrounding stroma of the cortex, which is surrounding the follicle, start to differentiate into the special connective tissue, which is made by special fibroblasts, and this layer attached to the follicle is called the theca folliculi. The theca folliculi. This layer contains those special fibroblasts I mentioned already. This is like highly vascularized layer, and these cells have the features characteristics of steroid producing cells. They possess a large number of luteinizing hormone receptors, and in response to this stimulation, they produce the androgens which serve as the precursor of estrogen. So it contains fibroblast collagen bundles and some kind of small vessels, which makes theca folliculi proper typical endocrine organ. So that's the primordial follicle. Then there is a primary unilaminar follicle with one layer of cuboidal follicular, now called granulosa cells. And this is primary multilaminar follicle, one oocyte. Here you can see the acellular eosinophilic zona pellucida layer and many layers of granulosa cells on basal membrane. This is again the multilaminar primary follicle with granulosa cells, and you can see some kind of special fibroblasts arranged um, around the follicle, which starts to form the theca folliculi interna. That's the same. You can see the oocyte, proper zona pellucida, and then one layer of granulosa cells, which starts to become two-layered, like here. So that is like interstep between the unilaminar and multilaminar primary follicle. Secondary follicle is made by oocyte, which travels eccentrically to the edge of the follicle, and it is still surrounded by zona pellucida. You can see that in the layers of granulosa cells, there start to appear many small cavities. They are fluid filled, and they eventually coalesce to the single cavity. The viscous fluid, which is inside of these spaces, is called the liquor folliculi, and the single cavity, which will be there eventually, is called the uterine folliculi. You can see that the stroma surrounding the follicle is now differentiated into the theca interna, which is like internal layer of theca folliculi, made by theca cells. Theca cells. Those cells are the typical androgen-producing cells, and theca externa, which is like more externally, which is composed by the connective tissue and smooth muscle cells, highly vascularized connective tissue. So stromal cells, those special fibroblasts, form an outer covering or layer surrounding the follicle, which is called the theca folliculi, dividing into the theca interna and theca externa. The interna is more vascularized because it serves as an endocrine organ, and it contains steroid-producing cells, namely the androgen-producing cells. And theca externa are like typical highly vascularized connective tissue with the fibroblasts and smooth muscles. So theca interna, these cells, they have characteristics of steroid-producing cells. Theca externa, normal fibroblasts and smooth muscle. So the cells of granulosa contain aromatase, which is like enzyme transforming androstenedione into the estradiol to produce estrogens. The theca internal cells, the theca cells, they produce androstenedione. As I mentioned, they have the characteristics of steroid-producing cells. So this is how it looks like. This is the theca cell, the special fibroblasts which can produce steroids in theca interna, and this is the granulosa cell within the layer within the follicle. So the theca cell has receptors for luteinizing hormone, and under the influence of the luteinizing hormone, it produces androstenedione from cholesterol, which is then transported into the granulosa cells. And granulosa cells, they have receptor for follicles for follicle stimulating hormone from adenohypophysis, and under in response to the FSH stimulation, it produce aromatase, like an enzyme, which can transform androstenedione from TK cells into the estradiol. So this is the mechanism of the production of estrogens in ovaries. So these are the secondary follicles. You can see the secondary follicle. It has many layers of granulosa cells, and within these layers start to appear the fluid-filled spaces, which eventually merge together to create one great cavity called the antrum folliculi. Again, the secondary follicle with little spaces which will merge. That's the same. And again, this is the forming follicular antrum. And this is the cortex of ovary. You can see many primordial follicles which are located near to the tunica albugina. This is number 4. So just under the surface. And then deeper within the cortex, you can see another stages of follicular development, like the primary unilaminar follicles and secondary follicles and so on. So again, let's see the development of follicles, which is here, secondary, tertiary, and the secondary then will turn to the tertiary or mature Graphene follicle. The Graphene follicle has one antrum filled with fluid. The oocyte is moved to the one side of the follicle to create cumulus oophorus. It's some kind of accumulation of granulosa cells around the oocyte, and it bulges to the surface of the ovary like the stigma, as the stigma folliculi, like that. Then during ovulation, the oocyte with the few layers of granulosa cells is released into the peritoneal cavity, and it is infused to the ovarian uterine tube, and so on. So the rest of the ruptured follicle stays within the cortex of ovary, and it will change and transform to the corpus luteum, like that. So the mature Graphene follicle has the oocyte on the periphery of the follicle. This accumulation of cells, the cluster of granulosa cells surrounding the oocyte, is called the cumulus oophorus. The granulosa cells surrounding the oocytes, these yellow cells, are called the corona radiata, and they accompany the oocyte during ovulation. This is the ovulation. You can see again the bulging to the ovarian surface as the stigma folliculi and the ovulating egg. So this is the Graphene follicle with one follicular antrum filled with follicular fluid, and this is the cumulus oophorus with oocyte and corona radiata, like that. So these structures are released during ovulation, these structures. Again, so this is the Graphene mature follicle with follicular antrum, cumulus ophorus, oocyte, corona radiata, and this part will be released during the ovulation. What is corpus luteum? So it's the remnant of the follicle, ruptured follicle, after ovulation. At first, the antral space is filled with fluid containing fibrin, and of course the blood from the ruptured blood vessels. And this will cause the production of connective tissue and fibrous tissue within the follicle. And eventually the corpus luteum will be placed by the fibrous scar tissue, which is called corpus albicans, white body. Corpus luteum, like function endocrine organ or tissue, is made by two types of cells. The granulosa cells will transform to granulosa lutein cells, and the cells of the theca interna, the theca cells, will transform to the theca lutein cells. Why the lutein cells? Because they are under the stimulation of luteinizing hormone, and they will produce hormones, hormones like especially progesterone, during the second part of ovarian cycle. So this is the wall of the corpus luteum, which is composed by granulosa lutein cells, number 2, and theca lutein cells. The center of the corpus luteum is filled with coagulated blood and then the connective tissue. Under the influence of luteinizing hormone, there are changes of granulosa and theca cells. As I mentioned, they will transform into granulosa lutein cells and theca lutein cells. Granulosa lutein cells will increase their size, and they represent about 80% of the parenchyma of corpus luteum, and they secrete. They are like typical protein secreting cells. On the other hand, theca lutein cells, they are typical steroid producing cells because they produce androstenedione still, but now they produce also the estrogen, progesterone. So this is the detail. This is the center of corpus luteum with the blood and fibrin and so on. This is the layer of granulosa lutein cells. Please notice that within the layer of granulosa lutein cells, there are the blood vessels or the blood capillaries. That's the difference between the granulosa cells and granulosa lutein cells, because when you're looking at the follicle, development of follicle, and you're trying to find the blood vessels within the layer of granulosa cells, you won't find anything because there are no blood vessels, and these cells are neutralized by the diffusion from the tunica from the theca folliculi. But now, in the state of development of corpus luteum, the blood capillaries move from the theca interna within the layer of granulosa lutein cells. And these are theca lutein cells producing the hormones. So we have some types of corpus luteum development. At first, or in the case that there is no fertilization, it is called corpus luteum menstruationis, which stops produce the progesterone after 10 to 12 days. Sometimes the degeneration of the corpus luteum will create fibrous scar called corpus albicans. But usually from these cycles, from not fertilized cycles, these yellow bodies, they just degenerate and they do not leave, they do not remain any proper scar. On the other hand, in the case of fertilization, there will develop the corpus luteum graviditatis, which grows and it produces the progesterone, which is necessary to hold the pregnancy and development of embryo. Then after about 8 to 10 weeks, the placenta becomes the major source of progesterone, and the corpus luteum is not needed anymore, so it will degenerate and create fibrous scar called the corpus albicans. Let's talk a little about the the ovarian cycle. It has two phases divided by ovulation. It starts with follicular phase, which is present by day of 1 to day 13, and during this phase, the follicular maturation occurs. This phase is under the influence of follicle stimulating hormone. Then, about day 14, the ovulation appears, and the oocyte and corona radiata are released, and of course the follicle ruptures, and the empty follicle will create the corpus luteum. Then the second luteal phase starts, and during the luteal phase, the corpus luteum produces progesterone for about 10 to 12 days, and then it ceases the hormonal production, and it will create a small scar sometimes. So that was the ovarian cycle. Let's talk a little about the development of oocyte, not the follicular development, but the oocyte development and divisions. I'm sorry that this picture is in Czech, but I don't have it in English. But maybe you do, because it's made when we were creating the Memorex of histology. So I don't have the English version of Memorex, but when I made this diagram, I chose to use it in my presentation. So I hope you don't mind. It's in Czech. So let's start with the primitive germ cell, primordial germ cells. The primordial germ cell is made, or it's derived from epiblast, and a lot of germ cells will migrate from the site near to the allantois and yolk sac within the genital crest, which is like embryonal structure where the ovary will develop. So during the embryonal development of the girl, these germ cells will migrate into the primitive ovaries, and then they will increase their number by mitosis. So the primordial germ cells will now be called the oogonia. Oogonia are diploid and they contain two chromatids. It means that there is single chromatid for one chromosomal pair, like that. The oogonia will then again divide by mitosis, and during this mitosis they will increase the number of chromatids. They will duplicate the number of chromatids, like that. So that means they are still diploid, and each chromosome has now two chromatids, like that. This stage is called the primary oocyte. The primary oocyte stay within the primordial follicles from the fetal period to the puberty. So when you are looking at the primordial follicles, you can see those structures I've mentioned, one layer of follicular cells surrounding the primary oocyte. So this is the relation between the development or maturation of the oocyte and maturation of follicles. Please do not be confused by the maturation of oocyte and maturation of follicles. It's not the same. So within the follicles, the primordial, primary, secondary, and tertiary, we can find the primary oocytes. There are primary oocytes. Because the primary oocytes, they enter the first meiotic division, like that, there, and they will stay, they will stop in prophase. So they will stop in prophase and stay there within the primordial follicles, and they wait for their moment, which can come during the puberty, or which can come during the adult life of the women, between the menarche, which is like initiation of the menstrual and ovarian cycle and the cyclic production of hormones and gametes, and menopause, which is like ceasing of these functions. So between these two moments, so the menarche is about 12-13 years, and the menopause comes between 55, 60, 60, yeah, maybe. It's really just it's individual. So it's pretty long time for the primary oocyte to stay in the prophase and wait in the primordial follicles. Then, during the first phase of ovarian cycle, that means the follicular phase, a group of follicles, which is called the cohort, starts to develop from primordial follicles, and they advance in their development. Most of these follicles from the group will degenerate, but some of them, usually only the one, the dominant follicle, will mature to the tertiary, the Graphene Follicle. When the Graphene Follicle has before the ovulation, the primary oocyte completes the first meiotic division and become the secondary oocyte, which is haploid. That means that during the first meiotic divisions, the chromosomes divide and the secondary oocyte contains only the haploid chromosome. Second cell which comes from this division is called the first pole body, which is just very small cell which lacks the cytoplasm, and it contains the rest of nuclear content. Secondary oocyte during the ovulation enters the second meiotic division, which will stop in metaphase. The secondary oocyte will stay there until the fertilization occurs. Then, after the fertilization, will complete the second meiotic division and to create the mature ovum and the second pole body, which will degenerate as the first did. So, this is the diagram of the oogenesis. Please notice that the number of oogonia, respectively the primary oocytes, is definitive, and there are no other oocytes which could be created and produced after the delivery, born of the baby, the woman. So about fifth to seventh month of the fetal development, there is the highest number of the oogonia within the ovaries of the fetus. It's about 5 million, and then the number only decreases by a process called atresia. So that's the relation between the maturation of the oocyte and development of follicles. It's important to distinguish between these two. Okay, let's proceed. We will talk about the fallopian or uterine tubes now, which are paired long muscle tubes suspended within the peritoneal cavity by mesosalpinx. And it has two ends. The distal end opens into the peritoneal cavity freely, and the proximal end is entering the uterine horns. The purpose of fallopian tubes is the transport and fertilization, and of course, the ensure of the proper environment for initial embryonal development. It has 4 parts. From the distal part, it's called the infundibulum, which opens freely to the peritoneal cavity with structures called fimbriae. Then the ampulla, which is the longest part, isthmus, and short intramural part, which is like here after the tubes enter the uterine horns. Fallopian tube has 3 layers. This is the transverse section, and from the inside to outside, it's the tunica mucosa, which is folded which is folded. These folds increase the surface, and these folds sometimes fill the lumen of the uterine tube. The height of the folds decreases toward the uterus. The epithelial lining is simple columnar, which is made by two types of cells. First type are the ciliated cells. Ciliated cells, they have on their apical surface, they have cilia, and this the movement of these cilia helps oocyte to be transported towards the uterine cavity, and small part of these cells also moves their cilia towards the ovary to help sperm reach the ovum. Second type are the secretory cells, sometimes called PEC cells. These are cells producing the special proteins to provide nutrition to oocyte and then the developing embryo. Tunica muscularis has two indistinct layers, the inner circular and outer longitudinal. It is made by smooth muscle, of course, and these layers or movement of the smooth muscle slightly helps the movement of the oocyte and the embryo. So, what are the differences between the ampulla and isthmus? So, between those parts of uterine tube. Within the ampulla, you can find prominent branching folds, which resemble a labyrinth because these folds nearly fill the lumen of the ampulla. And notice the thickness of the wall, which is thinner than in the isthmus, or of course the intramural part. In the isthmus, there are smaller mucosal folds which are not so prominent and not so branched, and the smooth muscle layer is much more thicker and prominent than in ampulla. As I mentioned, the ciliated cells decrease their number towards the uterus, and with that, the secretory cells increase their number towards the uterus. So this is the isthmus. You can see small, not so prominent folds, mucosal folds, and very thick, smooth muscle layer within the muscularis layer. Again, this is isthmus, and this is ampulla with highly branched, prominent mucosa folds. You can see one layer of cuboidal epithelium on the surface of the mucosal folds, like that. You can see cilia on the apical surface of these cells, and lamina propria, which creates the core of the mucosal folds. So the other is uterus, which is hollow pear-shaped organ with a thick muscular wall. it has some parts, corpus, which is like there, fundus, this part, corpus, fundus, isthmus, which is here, and cervix. Cervix is divided by the insertion of vagina into the supravaginal part and vaginal part. So the wall of the uterus is created by three layers, and it depends on which part of the uterine are we describing, because part of the uterus, the fundus and corpus, part of corpus, are covered by serosa, covered by peritoneum, serosa, and the lower parts, isthmus, cervix, and so on, are covered by adventitia because they are located subperitoneally. So the superficial layer can be either perimetrium, which is serosa, or the parametrium, which is tunica adventitia. The inner layer is always the endometrium, tunica mucosa, and the middle, the muscular layer, is called the myometrium. Endometrium is lined by the lamina epithelialis, so the epithelial lining made by simple columnar epithelium with the uterine glands, which are simple tubular. Then you can see lamina propria mucosa, which is pretty highly cellular layer, which is called the endometrial stroma. So this is the endometrium. It can be divided into two layers. Zona functionalis is much more superficial one, so it's near to the uterine cavity. This is the epithelium of endometrium lining the uterine cavity, simply columnar. These are the uterine glands. You can see that they are simple tubular glands. So this is the zona functionalis, or functional layer, which is the layer which undergoes the cyclic changes during the menstrual cycle and also is slotted off at the menstruation. The deeper layer is zona basalis, or basal layer, which is retained during the menstruation, and it serves as a source of new cells during the regeneration of the stratum functionale, or the functional layer, like that. So this part remains after menstruation and serves as the source of the new cells. This is myometrium, so these are the smooth muscle cells. Functional layer contains necks and bodies of the glands, and the basal layer contains the depths of the uterine glands. Okay, so we said that. Okay, what about the vascular supply of these two layers? It is different. The functional layer of endometrium is supplied by spiral arteries. Spiral arteries are here, and they supply the functional layer. Straight arteries, which are here, supply the basal layer of the endometrium. The difference and the individual vascular supply of these layers is necessary for the retention of the basal layer, because during the menstruation or during the ischemic phase of menstrual cycle, there is constriction of spiral arteries and ischemia of the functional layer of endometrium, but the blood is still flowing through the straight arteries, and the basal layer does still have the nutrition and oxygen. Menstrual cycle has four phases. It starts with the first day of menstrual bleeding, and it takes about 4 days of the menstrual bleeding, when the rest of functional layer is slaughtered off with the blood. Then the proliferative phase starts. It's about day 5, and the proliferative phase occurs like concurrently with the follicular maturation and ovary, and it is influenced by the secretion of estrogens from the ovary. So that's the follicular phase. Proliferative phase. During the proliferative phase, there is change in the uterine glands and stroma. Then, after the ovulation, about day 14, there is secretory phase, which coincides with the activity of the corpus luteum after the ovulation, and is influenced by the secretion of progesterone from the corpus luteum of ovary. And then there is a fourth, the very short ischemic phase, during which the spiral arteries are constricted, as I mentioned before. So, first the menstrual part or phase, during which the endometrium, respectively the functional layer of endometrium, is slaughtered off with the blood as the result of ischemia of the functional layer caused by constriction of spiral arteries. And the very important thing is that basal layer is remained to be the source for the regeneration of the endometrium. So this is proliferative phase. Let's see that the proliferative phase is regulated by estrogens produced by ovaries. The endometrium at the beginning of this phase is constituted only by a very thin basal layer, about 1 millimeter thick, and it contains only the basal portions, the depth of the uterine glands, and just the lower portions of the spiral arteries. So this stratum basale gives rise to the whole endometrium again, under the influence of estrogens in the follicular phase of ovarian cycle. So the epithelial cells in the depths of the uterine glands, they constitute again the glands, reconstitute the glands, and they migrate superficially to cover new endometrial surface. Stromal cells will proliferate and secrete extracellular collagen to the stroma, and spiral arteries lengthen again with the re-establishing of the endometrium. So the glands, the uterine glands, now they have a narrow lumina, and they are straight, but at the end of this phase, they start to appear pretty like wavy, like that. Within the basal portions of the epithelial cells of endometrium, there start to appear like the accumulation of glycogen, which causes like pale and empty appearance of the cytoplasm. So these are the glands at the end of the follicular phase, like proliferative phase. You can see the uterine glands with kind of wavy appearance, like that. And this is the secretory phase. Yeah. The glands become highly coiled, and they are filled with the secretion. So there is also the change of the stroma. Under the influence of progesterone, the stromal cells transform into the decidual cells. This is the transformation with the enlargement of these cells, and they start to accumulate glycogen and proteins within their cytoplasm. This is called the predecidual reaction, which then proceeds after the fertilization and after the implantation as the decidual reaction. So these are the glands during the secretory phase, highly coiled. You can see that the stroma is more pale. That's because of the storage of glycogen within the stromal cells. Okay, so that was the menstrual cycle. Then myometrium. Myometrium is composed by 4 very poorly defined layers of smooth muscle. You cannot distinguish those layers one from each other because they create very special and difficult network which is designed for the proper and efficient release of the fetus during the delivery. Isthmus is a special part which does not contain so many smooth muscle. The wall is more fibrous here, and it's thinner than the corpus and fundus. The endometrium in the isthmus does not change so much. It changes just slightly. It does not participate or normally it doesn't participate on the nutrition of the embryo and fetus. There is not proper site of the placental implantation, and the isthmus is important during pregnancy for the holding of the fetus inside. So you can see the secretory phase of endometrium within the corpus of uterus. Endometrium is here, then the myometrium here. You can see the endometrium, which can be divided during the reproductive period into the basal portion, zona basalis, and the functional layer, zona functionalis. And during the secretory phase, it means the secretory phase of menstrual cycle, we can also divide the functional layer into the stratum compactum and stratum spongiosum. Those are two layers, two parts of functional layer, which are only distinguishable during the secretory phase of menstrual cycle. The most superficial stratum compactum contains necks of uterine glands, and that is why the stratum compactum looks more compact, because the necks of uterine glands are narrowed and more straight than the bodies. And stratum spongiosum contains the bodies of uterine gland, which are during the secretory phase highly coiled and filled with fluid, which gives this part a spongy arrangement, spongy appearance. So during the secretory phase, we can distinguish the stratum basale, basal layer, and stratum functionale, the functional layer, which can be divided into the stratum compactum and stratum spongiosum. This is detail of the uterine glands with secretion within. And of course, this is case of how the epithelium does not supposed to look like. You can see the cellular atypia, which are typical for some stage of adenocarcinoma of the uterus. Cervix of the uterus. So that's the inferior part of the uterus, which is divided by the insertion of vagina into the upper supravaginal part, portio supravaginalis cervices, and lower vaginal part, portio vaginalis cervices. Supravaginal part, it has the cervical canal within. The cervical canal is lined by the typical one layer of columnar cells. But this part, so the portio vaginalis cervices, which is visible from the vagina during the colposcopy, is covered by the stratified squamous epithelium, similar to the epithelium of the vagina. So this is supravaginal portion of the uterus. This is a vaginal portion, sometimes called the ectocervix. So cervical canal of the supravaginal portion is lined by one layer of columnar cells. In this epithelium, secretory cells prevail. There are only secretory cells nearly. And the ectocervix is covered by stratified squamous epithelium, similar to the vaginal epithelium. I mentioned already simple columnar epithelium, and there are glands, cervical glands of the uterus. They are mucus secreting simple tubular glands, sometimes called the crypts. When the crypt has obliterated neck, then the secretion starts to accumulate within, and the gland will be dilated, and it's called the Nabatean cyst. It's just for the clinical practice. The vaginal part of the uterus is covered by non-keratinized stratified squamous epithelium, and the borderline between the endocervical canal and the stratified squamous epithelium of ectocervix is called the cervicovaginal junction. Cervicovaginal junction. It's very important to know this term and this problematics because that is one sign which is controlled by the gynecologist during examination, colposcopic examination, because this junction, so this is the ectocervix, this is stratified squamous epithelium, this is cervical canal. This part is lined by one layer of columnar cells. You can see also the cervical glands, mucosal glands, and this is the cervicovaginal junction. During the life, this junction shifts like outside to the ectocervix. That means that the columnar epithelium covers also this surface way to the ectocervix, for example here. Then during the life, after that, it shifts back within the endocervix, and this part between the original and then the other cervicovaginal junction, which is then again covered by stratified squamous epithelium, is then called the transitional zone. So, sorry, not transitional, but transformation. I'm really tired. Sorry. So, endocervix, again, here, one layer of columnar epithelium. This is the original when, you have girl before the puberty. So then the junction is here. Then during the reproductive life, the zone then shifts here to be ectocervically. This is then the original squamocolumnar junction because it's normally seen by gynecologists in the reproduction life of the woman. So it's originally here, and then it can shift back here endocervically, and the part between the original and new junction is called the transformation zone. It's very important to know this because within this epithelium there can occur some kind of cellular atopia, and this epithelium is also very vulnerable to the infection, especially by the human papillomaviruses. And the infection of these viruses can increase the risk of carcinoma, cervical carcinoma, especially type 16 and 18 of human papillomaviruses are very dangerous, and they are called the high risk viruses 16 and 18. So it's important because of this. I said that the prepubertal junction is within the cervical canal. Then in fertile age it shifts outside, and then sometimes it can shift back to the endocervical canal, and this transformation of the simple columnar epithelium into normal stratified squamous epithelium is called the metaplasia. Metaplasia generally is transformation of the one normal epithelium into another epithelium, which is also normal. But the metaplasia itself, it can be like precancerosis. It means it can be the site of the development of carcinoma. So this is called the transformation zone. And this is the microphotography of the junction of the columnar epithelium to the stratified squamous epithelium of the ectocervix. It looks like that. And this is how it's not supposed to look like. This is part of the junction with the immature squamous cells, and this is like beginning of the cervical carcinoma. This is how it looks like normally. You can see colposcopic view of the ectocervix. This is the orifice of the cervical canal, and this is the surface of the ectocervix covered by stratified squamous epithelium. This reddish part is covered by simple columnar epithelium. So this is the junction normally in the fertile age, and then it can shift back sometimes like that. We can see the parts of the epithelium which are covered again by stratified squamous epithelium, but this epithelium it's not supposed to be there. So this epithelium sometimes shows cellular atypia and nuclear atypia, leukomatosis, and so on, and it's called the cervical intraepithelial neoplasia, stage 1, 2, or 3. So it's like precancerosis, and it's the future. There is a high risk of carcinoma there, and this is like how it looks like histologically. You can see a lot of nuclear atypia and mitosis, so on. So these are the cervical carcinoma. Vagina is a smooth muscle tube which has 3 layers. The tunica mucosa is covered by stratified squamous non-keratinized epithelium. Then there is tunica muscularis, which has 2 layers, indistinct layers of smooth muscle, inner circular and outer longitudinal. And of course, like outermost is the tunica adventitia. The most important thing is to know that in the mucosa, in the lamina propria of the mucosa, there are no glands. The vagina it doesn't have any glands, and the fluid is ensured by the secretion of the cervical glands and also by transudation from the blood capillaries. This is how it looks like, the epithelium of the vagina. You can see several layers of cells with the basal cells on the basal lamina here, that, and lamina propria here. The epithelial cells, they store in their cytoplasm glycogen. Glycogen serves as a nutrition for microbial flora, which is very important in the environment of vagina because by the degradation of glycogen, the lactate is produced and it acidify the environment to pH 4 to 5, and this is very important to prevent infection of the vagina. This is past staining for glycogen, so you can see the storage of glycogen, especially in the superficial layers of epithelium, like that. And that's all from the internal reproductive organs. Let's talk a little about the external genitalia. Vulva is the common space where the vagina empties, and also where empties the external urethral orifice, and it's surrounded by the labia majora, labia minora. There is a clitoris. So let's start with the clitoris. You can see that there is erectile tissue, but this tissue is not similar to the cavernous bodies of the penis. These are like a network of vascular channels, and it's highly vascularized connective tissue which surrounds them. Okay, that's all. But let's talk a little about the labia majora and labia minora. Labia majora are like skin folds. They have two surfaces. The external surface is covered by typical skin with a lot of hair follicles and sebaceous glands. And internal surface is covered by stratified squamous, sometimes slightly keratinized epithelium, but without the hair follicles. But there are sometimes present free sebaceous glands. Labia minora are like more mucosal folds. They are covered by stratified squamous, usually non-keratinized, and on the inner surface there is never keratinized epithelium. And the core of labia majora and labia minora is made by connective tissue. Within the labia majora, you can find also the adipose tissue, but adipose tissue is not present inside of the labia minora. And labia minora, they cover on their superior surface, superior part, they cover clitoris to create a mucosal fold surrounding the clitoris, like that. Then the clitoris, it has like two parts, and on the distal part of the clitoris, right here, there is the Barcelone gland. It's the great vestibular gland, which is it composes of the alveolar gland, which is mucosal, and it is it's important for the lubrication of the vulva. Okay, I think that that's all from the external genitalia, the most important things I've said, and I hope that it was understandable. Uh, if you have any question, you can type me. You can send me an email or something. I would be glad for any questions. And I still hope that we will see during the summer semester, but I don't know. Hopefully we will see. Um, Maybe it will be over soon. So thank you very much for your attention and have a nice day. Bye.